sharing, and then I will just get started. All right, so I have everything written down for everything that I was able to get by 6 p.m. today. So I will try to answer some things live, but I do want to address some of the other things. So a little bit of a recap from the other video. I want to clear up a few things that I said there, and it could have just been me rushing to get the information out. In the other video, I talked about pandemic versus epidemic, and I used the words interchangeably, so I want to clear that up. A health pandemic is something that affects us globally. Several countries have it. But if it's just an outbreak or an epidemic, and those two words we can use interchangeably, that is usually isolated to one area, maybe one country. And that's when I was listing some of the other things that we've been through. Those were more epidemics. We really haven't had a pandemic in a while. And so I wanted to clear that up just because I tend to have OCD like that. I wanted to be clear about that. So COVID-19 is a pandemic because it is affecting us globally. A lot of countries are being affected by the same virus versus some of the things that I mentioned before where they were localized to either the US or other countries. Okay, so you guys remember that if you go back to see the other videos when I mentioned everything from SARS all the way down to the coronavirus. So I wanted to clear that up, sorry. The viral breakups, contagion factor. So when I was talking about the contagion factor of SARS in the last video being higher than that of corona, literally after finishing that video, maybe an hour or so later, because we're still getting information in, right? So we don't know a whole lot. And as information comes in, then we update people. So literally after I said all of that, we come to find, oh, it's not just the surfaces that we need to worry about, it's airborne. So we learned, so which now changes that information, meaning it is highly contagious because there's no way to contain it if it just gets out into the atmosphere. So we're not just worried about the surfaces, it's airborne, okay? So that's another thing I wanted to clear up about from the last video, viral infections. So we're talking about bacterial versus viral infections and viruses. So I'll use HIV as a model for viruses because it is the one of the most common, I think, that we know about or that we actually pay attention to because even the common cold is a virus. It's part of the rhinovirus family. So viruses already exist, and I said that in the other video, but they need a host cell to live, right? So they need us to be able to survive. They don't survive on their own just out in the open. They have to get inside of us and utilize our nutrients and everything, right? Hook right on into us. The thing about it is, for example, with HIV, they actually inject their genetic material into the our cells, right? So now they become agents, so to speak, of that virus, and our own immune system may go, oh, okay, that's just Jerome, that's just him, but it's not, because the genetic material of that virus is within that person. So now they can wreak havoc and infect other cells. And it's really nasty when they're infecting our white blood cells because we need those cells to protect us against invaders. So those are one of the things that I want to clear up about viruses, and that's how they replicate. Okay, I went over there. I mentioned pneumonia, when I was saying that I wanted to give other things people are suffering a platform. So it's not just corona. It's not just that we should be narrowly focused on. There's still influenza. There are still other things that are circulating. So the thing is with pneumonia, right? So that is an infection of the lungs, but it can be caused by a virus. It can be caused by bacteria. But the symptoms of that is basically that the air sacs within your lungs is being filled with either fluid or pus because of whatever pathogen has infected you. Okay, so I made sure to write that down to clear that up. The social distancing protocols. We're seeing reports where people are having parties, they're still being in contact, they're not distancing themselves. And the thing is, we want to comply with this, and it's just the responsible thing to do. 15 days has been time frame that they have pretty much allotted for us to see a good incubation period. You can be a carrier and be asymptomatic day 1 or 2 or 3. So they're just saying, hey, for 15 days, let's just stay where we are, self-quarantine, so that in case you are a carrier, you're not out here infecting other people. Because once your symptoms do start, if they were to start, this isn't to say that everybody is going to get it or that everybody is going to have symptoms. It's if you have those symptoms, you've kind of contained it, and now you can be cared for. Now we can direct our care to just you versus you and your entire family and or your group of friends, because we've self-quarantined. We've kind of stayed away from each other by enacting the social distancing. So that's the reason why we're doing it. Again, it's about that incubation period. They want time to go by so that if some symptoms were to show, you can show then. Okay, so we want to be responsible because 2 weeks really isn't a long time. But because we know that the virus is airborne, cities that are heavily populated by the millions, like Chicago, LA, New York, something that just goes through the air, it just can reach a lot of people in a very short amount of time. So that is why we're doing all of that. What else did I want to mention there? The access to care, shortage of supplies. Okay, so we're coming upon shortage of supplies. And you have these people walking around with surgical masks. They're buying up all the supplies. And what we want to do is kind of ask the public, if you can kind of fall back on that and leave those supplies for us, the people who have to treat you if something were to happen. The surgical masks that you guys are wearing, those are designed to protect a patient on the operating table, right? So the person who's wearing that surgical mask, it's not designed to keep or block large and small particles effectively. What it's designed to do is to keep any of the fluid or particles coming out of your mouth from going into the incision of the person who's on the table. That's the purpose of it. So if the surgeon is talking, giving direction, asking, hey, pass me this, I need this, let's close this, let's do this, they're not spitting into the wound. So that's the reason for that surgical mask. I think what people are really trying to look for is that N95 respiratory mask, and that's the one that is not so loosely fitting. It's very tight. That's the mask that people are looking for because that's going to provide you protection. So it's going to go both ways. But I would recommend, if you're not a healthcare provider, to try not to take those masks away from the people who need to protect themselves, because what good would it be if all the doctors and all of the nurses, they get sick and now they're laying in the bed next to you versus being at your side caring for you. So if we can get a little bit more perspective there, okay? Try not to just run up and buy all of those supplies away from us if you're not a healthcare provider. If you have some extras, please donate them to the hospitals, especially where they have those cases, so that the nurses are protected there. I mean, shout out to the pharmacists out there, my fellow pharmacists, physicians, nurses, all of you, because nobody's willing to just run into the fire. And if you have people who are there that are dedicated, we took oaths to do this, the least, hey, leave some of the supplies for us so that we can take care of you, okay? So if you can donate some of the things that you have, not inflate the prices, that helps everybody. That means we all take care of everybody, okay? And then I know some of you are thinking, well, what are we supposed to do? See, that's where you go back to what I was talking about in that video, how to boost your own immune system. Some of you may not have access to primary care. You may not have access to COVID-19 testing, but there's still things, like I said in the other video, that you can do at home to boost your immune system, to help you, okay? So what did we talk about? So they had a few questions. There were some questions about the 2 vitamins in question for boosting the immune system. So we talked about vitamin C and vitamin D. So I'm gonna clear that up real quick. Vitamin C, I did mention that that was a water soluble vitamin and the dosing. So I did say that a loading dose was about minimally 1 gram. That's the equivalent to 1,000 milligrams. The little regimen that I was giving everybody was 3 grams in the morning, 2 grams at night. Okay, what I did not do was a timestamp. Okay, so when I was just speaking about it, I wasn't very specific on how long you're doing that. So the recommendation is for 3 to 5 days, and then tapering that down to 1 gram every day for 7 days. So even if you did that, that would cover you for 2 weeks. Just about 2 weeks. That would cover you. So again, that was 3 grams in the morning, 2 grams at night for 3 to 5 days, then taper that down to 1 gram every day for 7 days. So that was the loading dose of vitamin C that you would take. And again, you don't have to worry about taking too much of it because it's a water soluble vitamin. Whatever the body does not use is going to excrete in the urine. Okay, so I wanted to clear that up. Vitamin D was the other vitamin that I was talking about in boosting the immunity. So I mentioned that it was a fat soluble vitamin, but what I did not say is that what you don't use, the body stores. So that's the difference between the fat soluble vitamins. Whatever you don't use, the body is going to store, and that's going to be proportional to how much body fat that you have. So it's going to store it in the adipose tissue, and that's when we want to be very careful when it comes to our fat soluble vitamins. Now that can show signs of toxicity if it's too much. But because most of us are deficient, grossly deficient, you really don't have to worry about that for a while. So even if you took it, you'll be doing yourself a solid by taking it to boost your immunity. In the video, I talked about the 50,000 international unit vitamin. Again, I probably didn't do timestamps on that. So that will, if you have access to that, maybe it's prescribed to you, maybe you have a supplement company where you can get access to the 50,000 international units of the vitamin D. You could do that every week for 1 to 3 months, right? So people who are not in the northern regions where we're out here where it's snowing, it's cloudy, we're not on the sun, on the beaches out in the sun, so we don't have the sunlight, activating vitamin D through the skin to be able to do the things it does in the body. So we're going to need a little help. And we're not just talking about vitamin D, but more specifically D3, right? And so once you do that for the 1 to 3 months every week, you're going to taper that down to where it's going to be once a month. So typically for the first 90 days, you may be on it weekly, and then they taper it where you're just taking it monthly. And then after that, I was talking about the 5,000 international unit dose that you could take daily, right? So you can take that one daily. So you can do either or. So you're taking the 5,000 daily, or you can do that big loading dose with the 50,000 international unit, where you're just doing it once every week. Okay. Someone had a question and a concern when they were talking about vitamin K and vitamin D. They were talking about the synergistic relationship between the vitamin D, D3, and K2 more specifically. And they asked, well, if you're increasing the vitamin D, should I increase the vitamin K2? No, we're not doing that. I do understand where the person was coming from because they have a relationship as it relates to the metabolism and absorption of calcium, but that's more in musculoskeletal health. We're talking about the immune system. So that's kind of like, this is our thing, with pharmacy. It's about dosing. At what dose are we eliciting what response? So we're not talking about musculoskeletal health in this instance. We're talking about boosting your immune system. So there are certain doses where it's just specific to that. We're not going to increase K because we're increasing D. Okay, so that was something that maybe in the thread I may have responded to it, but I did want to speak and say something about it in case there were other people. There are a lot of you, that look up these type of things, and you may see that there's a relationship with vitamin D and vitamin K. And there are going to be relationships with the vitamins because they work interdependently of one another. So you'll always see that. But you need to know when it's appropriate to do certain things. Another reason we don't want to increase that vitamin K in proportion to the vitamin D is because, again, that's another fat soluble vitamin. And also vitamin K is involved in our clotting factors, blood clotting factors. So what we don't want to do is throw off another system by increasing another vitamin for the wrong reasons, just because they have a relationship. Okay, we don't want you to be more susceptible to clotting your blood and making your blood thicker, thus increasing your blood pressure and all the other problems that can go into that when you're not keeping a balance there. So I also said just taking a multivitamin from A to zinc. So when you take the multivitamin from A to zinc, it covers that for you. So whatever relationships that you were looking to have, you're going to get that by taking the multivitamin. But when we're talking about these loading doses of vitamin C and vitamin D, we're talking about how to boost your immunity and protect yourselves during this time. You may not have access to either the medications, the care, or the testing for COVID-19, and you might come into contact. And so this is a way to protect yourself. There was a question about hand sanitizers, right? We want to make sure that they're alcohol based. They may be isopropyl alcohol or ethyl alcohol, which is fine. Minimally 70%. I'm seeing some sources that say 60%. I mean, hey, do what you can for now. But you want to make sure that it is an alcohol based sanitizer if you're going to use it. But again, what I talked about before, if you have the choice between the hand sanitizers and the running water and soap, we're going to choose running water and soap. Okay. Make sure that you moisturize after those alcohol based products, because alcohol is very drying to the skin, so we still want to keep that in mind. So some of the people, they saw me using my Smooth Like Butter. That's not a moisturizer. That is something that's an oil-based product that I have, and I use that to seal in the moisture. So usually after I wash my hands, they're still a little damp, and then I'll put that on, and it helps to seal it and keep everything up to par for many hours, actually. But true moisture is water, hydration. So you want to make sure that you're drinking enough water during this time, and that's going to be half your body's weight in fluid ounces every day to make sure that all of your tissues are adequately hydrated. We talked about, someone asked about with the supplements. Okay, so I will make a separate video about the supplements because all supplements are not created equal. And you may even have members of the medical community that say, oh, they don't really work, they're expensive urine, you're just going to pee it out. And although there's some logic to that, because they may be talking about the water soluble vitamins, whatever the body doesn't use is going to excrete in the urine. So that is true, but it's still being utilized in the body for the chemical processes that you need in the body. So that's still true. It does help, but because the FDA doesn't regulate supplement companies the way that they do pharmaceuticals, they're not testing these vitamin companies to say, hey, do you have 1,000 international units of this or that? And they're not doing that. Maybe they are checking to make sure that the conveyor belts are not laced with any type of pathogens or E. coli or something to that effect, but they're not doing it extensively the way that they do drug testing. Some of the medications, and I'm starting it again, some of this is still coming out, this information is still new. They're talking about some of the things. I remember saying it in the video about how back in the day we used to always see that Z-Pack being prescribed, and it would just go across the pharmacy counter all the time when people had the flu or they had the common cold. And we'd always wonder, I mean pharmacists, we'd always wonder, why are they prescribing an antibiotic for something that is viral? And so we're starting to see that come again. It's happening now. I was talking with a colleague just the other day about what was being prescribed. And then she said, yeah, they're doing the Z-Packs. I was like, really? Haven't learned. Okay. So there are other medications that are being used to treat in the COVID-19, and that one of the some of the anti-malarial medications that they're using. They're using some antivirals. There's even a medication that they're using, the hydroxychloroquine, that's in the category of immunosuppressant. A lot of people with rheumatoid arthritis, that's prescribed for that a lot. concerned a little bit about that particular medication being a suppressant of the immune system as opposed to something stimulating it. So I don't know, I can't speak to the why. The only thing I can speak to as a licensed registered pharmacist is how it works and what it does. That's the only thing that I can say. So I'm not here to say if they're right or wrong for using this in this instance when we know that we're dealing with a virus. But it's questionable if that's going to be effective for those people using that. Now, when they were using some of the antivirals, some of the reports and some of the research that I saw when they were using antivirals, like, oh, okay, well, there it is. Now that makes more sense for a viral infection, but I don't know that using something that's going to suppress or weaken your immune system is going to be the best thing for you. And so that's why these vitamins that I'm recommending, these supplements, are going to boost your immune system, because that's what's going to fight this thing for you and with you. And you want to make sure that your nutrition is up to par. We're going to cut the dairy. We're going to cut the processed foods. We're going to cut all of that. Give your digestive system a break. Fast. Just eat fruits and raw fruits and veggies for a little while you consume these extra loading doses of vitamins to help build you up. Because some of these symptoms and the systematic inflammation that you're experiencing is by way of the food that you're eating. You're probably not tolerating it, or it's causing an immune response to you because it's actually it's triggering it. So if you ever eat something and you notice an allergic like reaction, then you shouldn't be eating it. So you definitely want to think about, while we're being quarantined, while we're in the house eating, watching what you're eating, because you don't want to weaken your immune system anymore from trying to break down the food that's incompatible with you. And then we got this virus running rapid. And it's just going to it's just going to be too many problems, right? So that's what you want to do there. I wanted to make sure that I got all, because I wrote down all of these questions from the inboxes. I don't see in many of the questions there. I did see someone about the symptoms, what to expect. I also said that in the other video, you're going to expect mild like flu-like symptoms, okay? So what are those symptoms of the flu? Fever, sore throat, body aches. Those are the, what I would say the top three that will fall in. Then you'll see some of the other regular symptoms of having a cold. Like, the runny nose, stuffy nose, those parts of it. But if you have that fever, that sore throat, that's how you know that it's viral. And of course, the testing for COVID-19 lets you know that it's that virus. But that's not to say that you don't have influenza either, if you're experiencing any of those symptoms. So I did see someone ask about the symptoms, and because they've been covering this a lot, I think that's something that everybody kind of have seen. You're like, okay, we know this much, we know that much. But what I wanted to do in providing this information is to give you something that you can do at home for you and your family. And it's very affordable to get these supplements. I do have a YouTube channel at Dr. Shante RX. I will put links to the supplements that I use for myself, my son, my mom, my patients. I'll be able to provide that for you guys if you guys want to know what we use. Again, I'm just here offering the information so you can certainly use whatever you have access to. But if you want to know what we're using, I can let you know what it is that we're using. I do not work for any of these supplement companies. I'm not an agent. I do not work for any multi-level marketing or network marketing firms for these supplements either. So I've always kept myself separate of that, especially when you're trying to inform the public. I'm not going to have any financial gain on recommending the supplements that I've recommended. But I can let you guys know what I use and what I've recommended to my patients, because they've shown results. So if any of you guys have any questions, again, the other video is very thorough and it's on my page, And I just wanted to just get on and answer these other questions that were also, there's a panel that I will be participating in tomorrow. So it's going to be more information, and it's going to be with the Chicago Women's Urban League Board. I'll be sure to post the flyer for that, what time and how, if whatever way that you guys can log on to that. So I'll be a part of the panel with some other doctors talking about this and what other questions that you guys will have. I mean, keep them coming if you have questions. I mean, there are always new developments about this every day, and we just want to stay informed. Again, these 2 weeks are going to be very long, guys. We'll be back out doing what we were doing before you know it, but it takes longer for us to get there when we have people resistant to actually complying with what the government officials are asking us to do. Trust me, it is for your protection to just stay quarantined, self-quarantine. I mean, we have DJs that are playing music and doing things to help keep us involved, and I'm sure there's some things that we can all do at home that we needed to catch up on anyway. So again, everybody be well and be safe. I'm going to close this out because we've gone through most of the concerns and questions and things that we needed to clear up. I don't see many more, but thanks you guys for stopping by, and that's pretty much it for this Q&A. Feel free to drop in the comments if you do have any questions or concerns, and if you don't want to display that publicly, you can send it to me to my inbox, or you can DM me on Instagram. I'm the same name on Instagram, Twitter, YouTube, all of that. Dr. Shantae RX. You'll find me. Make sure you're following the page. You'll be able to get all of the updates. And so yeah. Oh, I see. I'm getting distracted by the comments. But again, I'll see you guys. Hopefully you guys will tune in tomorrow. I'll be joining their panel with the oh, good, Jasmine. You put that up there for me. Thank you, because I was about to just torture that name. So you guys be good, and okay, try not to fill up on processed foods, raw foods right now. Okay, water. I prefer alkaline water, but I don't have access to it right now, so I do spring water as a backup, or water with lemon to increase the pH of the water, so that you can have a little bit of alkaline water with that. Okay, so stay hydrated, and you can get those supplements. They're affordable. Don't forget the dosing. Don't forget the time schedules. And again, if you don't know where to go or you're not sure, I haven't missed a day. So I'll put the links in the description box at the when I upload it to the YouTube channel, so that you can get the links. And maybe I'll do it on Facebook too. I'll figure out how to do that so you guys can know what we're using if you would like to know what we're using. So I'll see you guys hopefully tomorrow on the panel that I'll be also talking about the COVID-19 with. All right, guys. See you next time.